Good morning, everyone. You're welcome to the seminar, the departmental seminar of Department of Human Anatomy, Northwest University, Kano, Nigeria. Our presenter is a professor in human anatomy in Near East University, Cyprus. But before we start, I would like to invite Professor James Timbuak to give us an opening remarks and to welcome our presenter. After that, I'm going to give the citation of the presenter before she goes ahead with her presentation. Thank you.
Hello, good morning, everyone. Good morning, our presenter, Professor Metab, and good morning, HOD Anatomy. We are pleased to have you for today's departmental seminar. As you are aware, this seminar is supposed to be part of the presentation in the past conference. But unfortunately, due to some events that came up, we were not able to take the presentation. And so the presentation has now been scheduled to take place today. So we wish to thank our presenter for making herself available. And we also encourage all the participants to make the most out of this presentation. Thank you very, very much.
Thank you, Prof. So I'm going to read a brief citation of Professor Mehtab before she begins her presentation. Professor Mehtab graduated from Hacettepe University, Faculty of Science, Department of Biology in 1984. She received her Master of Science degree from the same university, Department of Morphology in 1998. She gained her PhD in 1991 in the same department and worked as an anatomy instructor until 1992. In 1992, she moved to Istanbul and started working at the Marmara University School of Medicine, Department of Anatomy as an assistant professor. In 1995, she was promoted to Associate Professor of Anatomy. She worked at the Baylor College of Medicine, Houston, Texas, as an anatomy instructor for the surgeons in the Department of Surgery between 1996 and 1998. She also attended the Department of Neuroscience at the University of Texas as a visiting professor during the same period. In 2000, she returned to Marmara University and was promoted to professor in 2002. In the same year, she resigned and moved back to the United States, where she took a residential design course at the Art Institute of Pittsburgh and completed her diploma program in 2007. She continued her interior design program and completed her BS in 2010. She worked in the same faculty to instruct AutoCAD, Photoshop, and SketchUp until 2015. She has been teaching anatomy at the Near East University Faculty of Medicine, Department of Anatomy since September 2015. She has also been assigned as the head of Department of Physical Education and Sports of the Near East University Graduate Studies and the Dean of Sports Faculty between February 2018 to September 2025. She's a scientific board member of the Brain and Conscious States Research Center at Near East University and a board member of the Research Center of the Sports Sciences at Near East University in Nicosia, the Turkish Republic of Northern Cyprus. Professor Mehtab, you are most welcome to this presentation, and I think you can go ahead with your presentation. Thank you. I think you are still muted. Okay, can you go ahead now?
Okay.
All right.
I think it's hard now.
Okay, great. It's so good to see you.
You too. Thank you so much
Thank
your
you.
nice welcome. And finally, I can connect with Nigeria today. So, and actually, I want to greet everyone attending to this seminar today with me. So, well, esteemed faculty members, my colleagues, and all of the members of the University of Kano, Department of Anatomy. It is really nice to, be in the same time in the not face to face, but almost in a situation like this. So this is very lovely. Thank you so much for being here today with me. So let me just go ahead and try to share my window with you. Hopefully everything is working fine. And I'm going to go to a full screen with my presentation. So, but before I start this one, I want to congratulate you on your recent congress. That was a great success. I followed it online, and actually, I also want to congratulate you on your brand new virtual section table. It is so big success indeed, and I honestly envy you guys. So on that one, hopefully we're going to get one, not real soon, but maybe in the near future. I don't know. So here is my presentation related to those, VR technology or adaptive learning technologies. So I'm not very familiar with using those except for the 3D animations and so forth. But I was just thinking what I can just, share with you guys in terms of the AI technology. And as a, old school anatomist, I have been just thinking of it. And I'm just going to share with you only my opinions as a long time anatomy experience, let's say. I have been witnessing so many time periods all by myself from the radio times to the present day. So that is another, view perspective by an anatomist. Okay, so I named this presentation as the virtual reality of Versalius because I think my presentation is kind of representing Versalius's virtual anatomy when he would have just, seen today's anatomy teaching, even with the traditional lecturing and human cadaver dissections. He would have felt like, he was a head device in order to just, view way future anatomy teaching methods. But today I'm talking about the Versalius, but me myself, well, it is exceeding our, our dreams, our imaginations. So we don't know the conclusions yet, but yeah, I'm going to talk about a little bit of history, the timeline of the anatomy and dissection. And as we all know, as the anatomists are interested in anatomy, human anatomy is based on the human curiosity and, of course, the careful observation of the natural phenomena, so as all the other disciplines. And for the centuries, there have been many inventors or the scientists working on the or exploring on the human body with a desire to explore more and more all about it. So now I want you guys to get a virtual tour with me, not the virtual intelligence, but I think it is kind of a part of it with my old school slideshow. And I want you guys to put your, imaginary head devices over you and imagine with me throughout the timeline of anatomy. So in the 21st century, of course, the anatomy education is undergoing a significant transformation from the traditional anatomy lectures and dissection to, to the AI and VR technology. But now I want to take you guys into all the way back to 3000 CE. So 3000s actually. So the dissection is the first time, or to our knowledge, started with the mummification during the ancient Egyptian period. So ancient Egyptians believed that that the journey to eternal life was possible in case they were just buried with their heart and excluding all the other organs and wrapped up with the resin, soaked, just linen strips and all. So, and then they were just buried within their tombs next to their household. So that was their religious beliefs. Of course, that was a very costly procedure by the time, and it was just taking about 70 days to complete. So simply that was kind of plastination of the human corpse after the death. If you just, imagine the simple steps of the mummification during those times, they were just basically covering the dead body with the natron, or I think natron, and that was a natural salt to release the moisture towards the salt from the body. So that was just with the reasons of the losing the moisture in the body for about 40 days. And then the organs were just removed from the cavities except for the heart, because again, they believed in the heart was the center of the soul. So for the eternal life, we needed our heart stay with us. That was their belief. So, and then the body cavities were stuffed with the linen strips and herbs all together. And eventually, after about another 30 days, the body was wrapped all around with the resin-coated linen bandages all thoroughly before they're just, put into their tombs forever. Well, we know that the plastination known, as started as of the 1977 by von Hagen, but I think plastination is started by the ancient Egyptians about 3000 BCE. So now I want to take you guys into the ancient Greek times. So, okay, just one sec. All right, so the ancient Greek times are just taking place about the 500 and 330 BCE. So we know some very famous names, or noteworthy names from the ancient Greek periods, like sorry, I need to just get this window so I can see my slides. All right. So the first name, just coming into my mind is of course the Hippocrates. Hippocrates lived around 400 BCE, and he was the first setting all of those ethical rules for the physicians, and his rules or ethical, oath has been taken place for centuries for now, and the pledge is all about the practicing the medicine in the most ethical way and not to harm to their patients, as all of us know by now. So also there is the Alcmaeon of Croton, who lived around the same time, 500 BC actually, and he was the one thinking the soul and the heart within the brain. And well, he was the first actually. There is such a brain that was just, kind of physiologically directing us. So he was just kind of the foundation of the physiology, kind of. So Aristotle, of course, Aristotle was the one by this period again started the dissections on the animals, because he was also wondering the structures, the anatomical structures within the animals. And of course, the Herophilus of Chalcedon. Chalcedon is now today's region in Istanbul, Kadıköy. Herophilus from Chalcedon actually is the one started the dissections, but it's a bit cruel way. Actually, he was the one vivisected the criminals' bodies. So it was about 400 bodies that he vivisected. So this depiction on the background is told to be Herophilus, and Erasistratus next to it. Well, actually, he was the student of the Herophilus. Actually, they both have done a lot in terms of the foundation of anatomy, indeed. And they were also the first ones to found the Alexandria, which is the first medical school in Italy. So I need to go back to my I'm sorry, I'm not very well with the Zoom presentations. Actually, we used to use Google Meeting during the COVID, but right now I need to go back to my PowerPoint presentation so I can change my slides. Oh no, it's right here. I'm sorry, as I was telling you. Okay. We're speaking about the VR technology, right? So, all right. So ancient Romans, they lived in between 650 BC and 480 CE, or Common Era. So you can see another very famous name, Galen of Pergamon, lived during these times, and he was a educator for the medical students, and he was another one dissecting the animals, particularly the monkeys, because he was really into brain, spinal cord, and the heart anatomy. And he was also the notorious physician for the gladiators who fought and wounded during the arenas. So these depictions are not as old as him, of course. Those are pretty much later on modern depictions when you just, compare the ancient Romans. So in the meantime, we have the Islamic Golden Age in between 700s and 1300s. So again, the first name coming into my mind is Ibn Sina. Ibn Sina is known as Avicenna in Western society, and he lived in 982 1037 CE. So and he published a book published or wrote actually a book of the medicine, which is known as the canon of medicine or canon medicine, with many parts of anatomy and the healing methods and everything. So he was a great scientist, by the way, and also the Muhammad al-Razi. Muhammad al-Razi was another related to the physiology, and Ibn al-Haytham also just worked on the optics or optic nerve and so forth. And Ibn al-Nafis was the scientist by the Islamic Golden Age who actually worked on the pulmonary circulation. And as for the Mansur ibn Ilyas, who lived during the 14th century, he was the one just, publishing another book of anatomy, kind of the atlas with his own drawings, as you see over here. And another period era is the late Middle Ages during the 1000 to 1300 CE, where the medical school of Salerno, first Western school, it is known also, first Western medical school has been founded in South Italy. And also the medical school of Bologna in the same period by Taddeo Alderotti. Actually, this school was founded in the disciplines of the medicine and law interacted with each other. So Mondino de Luisi, who was the student of the Taddeo Alderotti, also founded another anatomy library by the time during the 14th century, and he also drawn and published this book of the Anatomia Corporis Humani, human body anatomy, which also known as the inevitable fatum, inevitable fate. Actually, that's the meaning of it. So the next period is so famous and colorful in the view of anatomy or human body, actually. Colorful, the most colorful era, the Renaissance period, comes around during the 14th to 17th centuries. And many other notable artists and anatomists just, came out with their awesome books and drawings and so forth. So of course, the Leonardo da Vinci and his sketches during the 14th to 15th centuries are most famous ones, or among the most famous ones, as well as the Michelangelo. Michelangelo was working on the human body for his depictions, and he was a very accurate drawer, of course, with no, regrets about it. So he was the one just depicting perfect human bodies here and there. But Leonardo da Vinci started these sections of the human body with interest of the anatomy, and he was just very curious about how the human body was working and how the structures are related to each other and so forth. And his awesome drawings are just coming together with his curiosity of the human body, anatomy, physiology, and so forth. And he just, represented many unknown points as for anatomy. And then the father of anatomy, aka the Andreas Versalius during the 16th century, he came out with 7 books of anatomy drawn by his hand, and in the very artistic way, very impressive way, and known as the Fabric of Human Body, or Fabrica Libri Septem, Humani Corporis Fabrica Libri Septem, the 7 books of the human anatomy. And his drawings are not only depicting the human anatomy in the best way, but also very artistic way. So it was very, very impressive by the time. Well, I always very much appreciate all of those who contributed to, learn human body structures and physiology altogether by their works. They're incredible works indeed. Well, I need to just highlight their creativity right here. So creativity, of course, is the one, human creativity, of course, is the one just, getting all of us to here today. I think I drew some things in the meantime. I'm sorry. So, and here is another. Okay, I don't want to annotate, so I'm trying to. Okay, just close it. I hope you're not seeing that my, lines that I drew over here on the monitor. If you see, just, I apologize about those technological inabilities, let's say. Okay, here is another artist's and surgeon's books. So this is Walter Herman Riff, who lived during the early 16th century. He wrote and drew the Great Surgery book, as you can see. Those are also very artistic way. So the depictions were just looking like we are looking into the living people, although their organs are out and they have been, dissected and so forth. And the depiction on the left side of the visual actually is just showing one of those surgeries, surgical operations by the time. So when you just go ahead and see the next century, well, this is, okay, I'm going to try something. All right, I have. Am I the one doing this one or not? Because I don't even have the pen. Okay,
Sometimes it happens when there are people trying to join from outside.
Oh,
Get this
okay,
sort of
no problem.
influence. Yes, so don't
So
worry about
it's
it.
not me. It's a relief. Thank you so
Yeah.
much, Mariam.
All right.
So, all right. All right, let's come all the way down to 17th to 20th century. Okay. So this is, of course, the invention of the microscope. So many scientists that we all know, we already know, and much many more are just, came out with the microscope's invention, and they started inventing some new things every time they went with the microscope. So indeed, the modern medicine just followed all of those inventions after all. So I was wondering if we can just, match the invention of the microscope with new technologies of VR or adaptive learning and so forth. We probably can. But in the meantime, I want to appreciate at least this small list of these scientists who were always in our textbooks in anatomy: Passioni, Scarpa, Corti, Passini, Golgi, Merkel, Auerbach, Meissner, Edinger, Retzius, Silvius, Bajendi, Broca, Brown, Sequard, Betts, Horner, Kajal, Willis, Monroe, and Bell. And of course, this is only a very, very small percentage of all of those scientists contributed to figuring out our body. So here is another depiction of the human dissection in the anatomy lab by the time during the 17th century by Rembrandt. And here is some visuals which are actually showing the waxworks by the time of the 17th and 18th centuries, and they're still in exhibition in the Museum of the Florence. And down here, there is another Human Anatomy and Surgery Atlas, which is published by Taschen right during our time, by the anatomist Bergerie, which is a French anatomist, and another French artist just depicted all of those beautiful anatomy illustrations during the 17th century. So, and of course, we anatomists are all having our reference textbook as the Gray's Anatomy. So it was written during the 19th century by Henry Gray, and it was illustrated by Henry Van Dyke Carter, who was actually the colleague on the medical staff of the Henry Gray. So we still have been just following the new editions of the Gray's Anatomy as our reference book, and also the Sobota Atlas is our reference atlas. Johannes Sobota was a German anatomist during the 19th and 20th centuries. So, and of course, I cannot just skip the Pankow Atlas just because of the ethical, dilemma that his book just created. But his atlases were extremely useful, although the ethical dilemma related to whose depictions those drawings were and so forth. So So I'm going to come to those ethical issues anyway related to the anatomy. And next is the Frank H. Netter, another notable artist first, and then the surgeon. Actually, they put everything together and created a set of Netter collection, as we all know. So with the pathologies, anatomy, physiology, and many clinical relevances of the human body altogether. So, and as we just went through the anatomical practice over the time, there were many traditional techniques like the dissecting the human bodies. And although there was a huge gap in between the Herophilus and the Renaissance, the dissection just stopped in between because of those, vivisections. And then it started slowly by the late Renaissance and just took over in the scientific way and in the fresh and fixed cadaver dissection labs for the medical students. So we have the textbooks from the Galenic age to Versalius, and then it kept continuing all the way down today. So, of course, during the historical ages, those textbooks were just drawn by hand and published with the most primitive ways by the time, and they're extremely invaluable. And human skeleton, human bones were just used for teaching and learning anatomy, human skeleton as well. And then here comes some wax works, as we have seen during the slides that we already saw. And here comes the plastination after the 3D plastic models and digital platforms like the 3D digital animations, atlases, virtual dissection tables, adaptive reality and virtual reality technologies, and AI. AI in many ways helpful in our teaching anatomy or learning anatomy. So it is another assistance which is, which is just giving us another perspective, because anatomy itself was all about imagining so far. So we were just seeing the 2D illustrations and, the textbooks, except for the dissections, of course. When we see all those 2D visuals, we were just imagining the relations of all those structures one to another. So right now, with the new inventions of AI technologies, so we can now, put everything together in front of us, and we can just, blend everything, every opportunity, in order to see the human body in the best way we can. So let's go to next slide to see the sections of the plastination by von Hagen, as well as his artistic way of exhibiting the human corpse. And of course, again, it was so impressive, I just couldn't help but included the virtual dissection table once again. So, well, we know that plastination have been used for years now, since 1977, routinely with the sections and as a whole body. for the anatomy learning, but it's also, I mean, this technique is also used for exhibiting the human corpse in the museums, and it is really a big question whether that exhibitions are, ethical or not. We're going to just touch base to that one later on, but now I want to come to the ethics in anatomy teaching after just a little bit touch up to that point. So actually we have to take under our consideration in terms of the donated human bodies as the first thing, and then the students and instructors' perspective. So donated human bodies should have assigned consent, first of all, that they are going to be used as the human cadavers for the medical students or for the scientific reasons, and they should be knowing how they're going to be disposed in the end and how they're going to be treated during the procedures and so forth. So I think they deserve the heartwarm respect throughout the process, and from the transfer of them, transfer of the dead bodies, their donated bodies, to store them. The demonstration of them should just be done in the most respectful way, and the disposal or burying them in the end. So they should be, all of these steps should be as part of the rituals of respect, emotion, and empathy to the donated bodies. So in terms of these students, they should show the ethical behaviors towards the human cadavers. So this is a very good opportunity for them to just, develop their professional aspects in terms, or reflected towards their prospective patients in the future. So they should have or develop their emotional intelligence towards the human cadavers, so they can reflect the same respect into the living people in the future. So this table, actually the depiction or the graphic has been taken from Cornwall et al., who were just published during 2024. So it was impressive in terms of the consequences of, in case of replacement of the human cadavers with the AI, opportunities within the dissection room. So, in terms of the, human interactions, it is how it is going to be, affect the students and the instructors. So is it really interactive, or is it a kind of isolated learning? So they are all questions for now, and the most questionable part is the ethics, of course. So we need to just, think of the consequences, as we don't know anything about the consequences yet. So I'm sorry, I was a little excited today, and but before I leave the presentation, or actually I leave the question marks for you, I want to just, emphasize or underline some of those questions. The digital technology is more than ready, it seems to be, to transform our teaching or learning abilities. So how ready we are is the question. And what about the humanistic aspect? If we replace the technology with dissection rooms and the human interactions, how are those emotional developments are going to take place for the students? And how are they, showing the empathy towards the, or the respect to our cadavers? We don't know, but I believe that we are always going to need our emotions and creativity forever and ever, and we need to just preserve those couple parts of the humanistic aspect. So I don't know if we can, accept this challenge of just replacing the new technologies with our traditional methods, or we can put them together. I think that is the best, to apply a hybrid system for teaching and learning anatomy using the AI technology, because it is unavoidable. It is so great and just, providing a very enthusiastic way of learning experience indeed. But we cannot put our hands off the tactile learning of the human body. That's what I believe. And thank you so much for listening to me. Thank you. So,
All right. Thank you so much, Madam, for this wonderful presentation.
yeah.
And I think, interestingly, the last aspect of whether we are going to accept the change, the transition between technology, and traditional methods of teaching, I think it's something we discussed. Professor Timbok and I were having a discussion where I believe that we still need the two. We need the traditional, and then we need the new technologies coming up. But he is of the opinion, because my fear is that there are some variations that they may not really be taken into consideration by the new technologies. So we still need that traditional method of it. But Professor Timbuk believes that as the technologies are kind of evolving at an unprecedented rate, and they will reach a point that they will be able to, overcome these challenges that I'm foreseeing. I don't know if anybody has any contrary opinion or has a comment or a question for Professor. So please, over to you. Anybody?
Yes.
If you have any question, you can raise your hand and then I can unmute you, or a comment, or yes, I think Aileen wants to. Let me unmute Aileen. Okay. Yes, Aileen, go ahead. Oh, sorry. Yeah, I don't think she's unmuted. Okay.
Yeah.
Okay, so I had to click as well to unmute.
Okay.
So what I was saying is technology is great and it allows us to do so many things that we otherwise could not. But there is something important about analog skills. So the analog skills, the analog feedback and the learning we get, I think that can't be replicated with technology. That's all I wanted to say.
Thank you.
Maybe it's going to be only a fraction of the learning, but yet, especially for people who are going to become surgeons, I think the analog part is critical to their development. Just technology, which is going to be visual. I'm sure they'll find a way with haptic controls to give feedback, but still the analog skills can only be that touch aspect can only be obtained with the traditional methods, I think.
Thank you very much. Any other comment? Any comment or questions?
Actually, may I?
Yes, please go ahead.
Yeah, actually, I know the generation differences are just, playing a role right here because the gap in between, generations is getting larger and larger every time. So, and the speed of the technology and their adaptability to the technology is incredible. So I was actually just concerned about whether they can just see our point over here or not at all. That was my only concern. So in order to just, prevent this, maybe we educators need to just, highlight the respect to cadaver and how important the tactile learning is for the prospective physicians and everything. So I would really like more discussion about the subject with the view of the young generation. And I was really wondering what they think about this aspect. Thank you.
All right, thank you, Hojam. I think, Ibrahim, you can unmute and ask your question or make your comment. Ibrahim, are you with us? Okay. Professor Timbot. Okay, go ahead, Prof.
Okay, thank you very much, Professor Mehta, for your stimulating presentation. You were successful in taking us down the past lane, and then you connected us to the future. And now that the future is here, we have so much to cope with. But as Dr. Miriam has said, I'm a little bit optimistic about, where technology is taking us, even though the technology has a lot of catching up to do in terms of a field that is both static and at the same time dynamic. It is static in the sense that a lot of things that we have learned in the past largely remain the same, except for the variations that do occur. So we know that there's a critical limitation in the use of technologies such as AI, but again, with the improvement in technology, there is a rapid catching up to where the anatomical standards are. So I want to keep an open mind to see where that takes us to. It might take a long time or it might take a short time, but I do believe that we are going to see something significantly, in terms of improvement as the years come. Thank you.
Right, thank you very much, Prof. I see, okay, Anna is raising her hand, so let me try to. You can go ahead, Anna.
Good afternoon, everyone. Can you hear me?
Yes, we can hear you.
Yes, thank you very much, Hojam Mehta, for your great presentation. And yes, I agree with our moderator about if to touch the topic of the innovation technology, that it's, for my opinion, in the future, it should be something mixed because of, as Mehtap Hoca mentioned, like VR technology now, it's playing a great role in all the scientific departments and anatomy, I think, as well. But of course, for my opinion, also the traditional ones, the sectional holes, the cadaver, it also should be alive. And this is mixing with the technology, and that Mehtap Hoca mentioned about the difference of the generation. So for the future, our assistants, new assistants, they will already race in this one new technology era. But I think we have to use both of them. Like, I really agree with moderator opinion. It's a great chance for us. Thank you very much.
Thank you. Any other question? Maybe we'll take one last question or comment before we round up. Okay. I don't see any new comments. Okay. So, Prof. Sir, can you just give us the closing remarks so that we can go? We're trying to keep to time. It's almost the hour.
Thank you so much, Mariam.
Thank you, sir.
Thank
Professor Timbuk, are you here?
you. Okay.
Okay, it seems as if Professor Mehta wanted to say something.
Yes.
I don't know. Could we give her the ones if she has something to say?
No, I was just saying goodbye to you all, and stay safe, in peace, and see you next time, hopefully. Mariam, I'm very proud of you.
Thank you so much. Thank you so much. And I forgot to mention that Hojam is also an artist. I first saw her painting in her office when I first went to Cyprus for my master's, and it actually became my source of inspiration to start anatomical illustration. So thank you, Hojam.
Thank you so much. Bye.
Bye. So over to you, Prof.
So thank you once more, everyone, for having the time to jump into this seminar presentation. We thank our presenter, Professor Mehta, for insisting on this presentation. And honestly, I believe everyone who has listened has benefited immensely. We do hope that we are going to continue to explore means to keep this anatomical science alive by being able to infuse what we already have as traditional anatomy with the technology that is being developed. And I wish to thank participants who have logged in from various institutions. So many I cannot mention. We also have other professors here. I think I saw Professor Ikwere somewhere. I wish to thank you, sir, and other professors and highly placed academics who are here with us. And also thank postgraduate students, lecturers, and just name it. Thank you so much for being able to join in this conversation. We are looking forward to more presentations as the department continues to find high-level speakers so that all benefit from their wealth of experience. Thank you so much, and I do wish you a wonderful day ahead. Thank you.
Thank you very much. Thank you, everyone. Have a good day. Thank you.